Oftentimes you'll hear plastic surgeons talk about on-table results. So what does that mean? On-table result is what we see on the table immediately during the procedure after we've completed a certain step. So for a breast augmentation, after we put in the implants, close the patient up, we take a look at how things seem on the table, and that is what we consider our on-the-table result. For certain procedures like rhinoplasty, breast augmentation, there's a lot of satisfaction in getting that on-the-table result because you can immediately see how the patient may look. But it's careful to note that while the on-the-table result may be perfect, when you sit the patient up or when you stand them up, when they see you in the post-op period, things often look slightly different because then you have the role of gravity. So while you may have an amazing on-the-table result, the post-operative appearance may be slightly different. And that's why commonly during breast augmentation, we will actually sit patients up during surgery to see what things look like when gravity is having its effect. So here's an example of a patient. She came into me very flat-chested, desiring breast augmentation in order to improve her appearance and give her a more feminine look. You can see here is her pre-ops. Now here are some of the on-the-table results that I got, where I thought she had a very good look. And because we sat her up, it took a little bit of extra time. You can see here in a very early post-operative period, when she's only 2 weeks post-op, she has really an outstanding result. Now her scars are still pink, they will still fade, and by about 3 to 4 months they would be nearly invisible in her lower breast fold, but she has a much more feminine, natural appearance to her, and these were implants which were placed in front of the muscle. Thank you for tuning in.